Good morning. In our last video, we have seen the formation of the trigeminal nerve and its three divisions, including the trigeminal ganglia. Kindly refer our previous video for the introduction of the trigeminal nerve. In today's video, let us study about the maxillary nerve. Maxillary nerve. So understand the maxillary nerve. Already we have seen the maxillary nerve passes through the foramen of the skull, the foramen rotundum. You can see this is the foramen rotundum, and the maxillary nerve passes through the foramen rotundum of the skull. You can see it here, the foramen rotundum. So once it reaches the foramen rotundum, it passes anteriorly and it is found in this fossa, the pterygopalatine fossa. Okay, it is present inside the fossa called the pterygopalatine fossa. In the pterygopalatine fossa, it communicates with and it gives two roots which will form a large ganglia here, that is called the pterygopalatine ganglia. Here it will form the pterygopalatine ganglia. Okay, after it forms the pterygopalatine ganglia, the main trunk will continue anteriorly into the inferior orbital fissure. You can see it here. It's the inferior orbital fissure. That is the inferior orbital fissure. Once it comes out of the inferior orbital fissure, it gives some branches. And the termination of this nerve will be coming out through the infraorbital foramen to form the infraorbital nerve. So this is about a general scheme of the pathway of this nerve, course of this nerve. Now we'll study in detail about the course, relation and branches. First we'll draw a schematic diagram of a pterygopalatine fossa. So what I am drawing is the medial wall of the pterygopalatine fossa. It's the medial wall of the pterygopalatine fossa, followed by, we can consider this as the posterior wall of the pterygopalatine fossa. And this should be the anterior wall of the pterygopalatine fossa. So this wall is the anterior wall is a medial wall, is a posterior wall. Okay, posterior wall of the pterygopalatine fossa. Now the lateral wall is not there. We can see it directly from the lateral aspect. There is no lateral wall. So you can see we are not seeing anything on the lateral aspect. Okay, only the zygomatic arch is there. So lateral wall is laterally it is open. So that is the fossa. We have drawn it here. Okay. Now the nerve enters inside the pterygopalatine fossa through an opening here. That is the anterior end of the foramen rotundum. We'll draw the nerve using brown color. So this is the nerve which is entering inside through the foramen rotundum. Okay, here it gives two branches inferiorly and it forms a large ganglia here, that is a pterygopalatine ganglia. Then the nerve continues anteriorly into a fissure. There is a fissure which is seen along the inferior aspect of the orbital wall. You can see this fissure. There is the infraorbital fissure. Now it reaches the infraorbital fissure. The nerve reaches the infraorbital fissure and it passes through the infraorbital fissure. After passing for a little distance, it enters inside a small canal which is present along the inferior wall of the orbit. That is the infraorbital canal. So the nerve enters inside the infraorbital canal, passes through the infraorbital canal to reach the infraorbital foramen. So here is the infraorbital foramen. Now the nerve comes out through the infraorbital foramen. This is the infraorbital foramen. Once it reaches out of the infraorbital foramen, as we see, this branch, it will divide into many branches to supply the lower eyelid, to supply the nose, and it will supply the cheek. So it will divide into branches to supply the lower eyelid, to supply the nose, and also the cheek. Now here we will draw the relatively position of the eye, the lower eyelid, nose, the mouth. This is the hard palate. This is the hard palate. The lower jaw. Now this nerve which is emerging here divides into branches to supply the, it's not the color, to supply the nose, lower eyelid, and the cheeks. Now we have labeled all the parts. This is the foramen rotundum to enter inside the pterygopalatine fossa. Now leaving the pterygopalatine fossa, it's entering inside the infraorbital fissure. From here it forms the nerve of the infraorbital groove. Is the nerve of the infraorbital groove. So here will be the groove, the infraorbital groove. So the nerve which will be present in the infraorbital groove. Then it will enter inside the infraorbital canal to form the nerve of the infraorbital canal. Then it will emerge out through the infraorbital foramen. This is the infraorbital foramen. It will enter inside the infraorbital through the intraorbital foramen to divide into terminal branches to supply the eyelid, lower eyelid, the nose, and the cheek. Okay. Now let's study the branches in each parts. Before it enters inside the pterygopalatine fossa, before it passes through the rotundum, it gives some meningeal branches to supply the dura. Okay, these are the meningeal branches. Meningeal branches to supply the dura. Next, after coming inside the pterygopalatine fossa, it is forming the pterygopalatine ganglia by the two roots, pterygopalatine ganglia. From the pterygopalatine ganglia, there are two individual branches which will be emerging down and passes through a bony canal. It will pass through a bony canal here. And this canal is called Greater Palatine Canal. Greater Palatine Canal. And the nerve which are passing through that is called Greater and Lesser Palatine nerve. This is the Greater Palatine nerve, and this is the Lesser Palatine nerve. The second one is the Lesser Palatine nerve. So these two nerves travel through the Greater Palatine Canal to enter up to the hard palate, to enter through the hard palate. So there will be an opening in the hard palate on the posterior aspect here, and one more opening is present little anterior to it. And through these two openings, the nerve will emerge out onto the hard palate. It will come out through the hard palate. And this foramen is called the Greater Palatine Foramen. Greater Palatine Foramen, along with nerve. Which nerve? Greater palatine nerve. Similarly, the posterior division, this is the lesser palatine nerve, will enter through the lesser palatine foramen. First, we will see the course of the lesser palatine nerve. This lesser palatine nerve goes along the hard palate. So, this is actually the palate. This entire thing is the palate. Okay, hard palate. So, goes posteriorly and enters inside the soft palate. So, soft palate, we'll use the pink color to draw this is soft palate. And it will supply the mucosa and the glands of the soft palate. And also it gives a branch to supply the palatine tonsil. So this is actually the palatine tonsil, to supply the palatine tonsil. So this is tonsil. So it is giving tonsillar branch, and this is soft palate. It is giving branch to the soft palate. That is about the lesser palatine nerve. Next we will see the course of the greater palatine nerve. From here, after entering through the greater palatine foramen, it passes along the hard palate and it will supply the mucosa and the glands present along the hard palate, covering the hard palate. So that is about the greater palatine nerve. Inside the greater palatine canal itself, the greater palatine nerve will give branches, multiple small branches, which will go and supply posterior and the inferior aspect of the lateral wall of the nose. It will supply the posterior and the inferior aspect of the lateral wall of the nose, and hence these branches are called posterior inferior nasal branch. Okay, so posterior inferior nasal branch. These are the posterior inferior nasal branch. Similarly, we have posterior superior nasal branches, which are directly coming from the ganglia. So these are the posterior superior nasal branch, which will be entering through a foramen present on the medial wall itself. And after entering through the foramen, it will divide into two branches, the medial branches and the lateral branch. The medial branch will be supplying the superior aspect of the nasal septum. So it will be supplying the superior aspect of septum. There's a medial branch. Then the lateral branch will divide into multiple branches to supply the posterior lateral aspect of the nasal lateral wall of the nose, posterior part of the superior aspect of lateral wall of nose, mainly the superior concave and the middle concave. The inferior concave is mainly supplied by posterior inferior nasal branch. Okay, during its course, it gives a long branch. It gives a very long branch which will come out through anteriorly through incisive foramen, through an incisive foramen. I'll show you the incisive foramen in the skull. So inferiorly, you can see along the hard palate on either side of the palate and process of the maxilla, the midline. You can see this is the incisive foramen. This is the incisive foramen. Okay. So through the incisive foramen, it will emerge out to supply the anterior aspect of the palate. It will supply the anterior. This branch is called nasopalatine nerve. This is called nasopalatine nerve. This is called the nasopalatine nerve. Okay. So these are some of the branches, and there are branch that supply the nasopharynx, and these branch emerge from the posterior aspect and passes through a canal present on the posterior wall. So this is the posterior wall, pass through the canal present on the posterior wall to supply the nasopharynx. Okay, these are the pharyngeal branches, and this pharyngeal branch is passing through this canal called the palatino-vaginal canal. Palatino-vaginal canal. So the posterior branch, which is supplying the nasopharynx, is going through the palatino-vaginal canal. Okay, so these are the branches which are coming from the pterygopalatine ganglia. So the branches coming from pterygopalatine ganglia is mainly supplying the pharynx, the soft palate, the tonsils, and the mucosa and the glands of the hard palate. Okay, including the nasal septum and the lateral wall of the nose. Okay, next we'll study about the branches coming from the main trunk inside the pterygopalatine fossa. So the branches which are coming after the ganglionic branches are given off is, one is a zygomatic branch which will enter through the infraorbital groove. It will enter through the inferior orbital fissure. So it will enter through the inferior orbital fissure, and then it divides into two branches, zygomatico-temporal and zygomatico-facial. So zygomatico-temporal and zygomatico-facial. This is zygomatico-temporal, which will supply the temporal aspect of the face near the temple. Temporal, zygomatico-temporal, and this is zygomatico-facial. So zygomatico-facial will come out of a foramen which is present on the zygomatic bone, and this foramen is the one. This is zygomatico-facial canal, zygomatico-facial foramen, which will supply the cheek. And this zygomatico-facial nerve will emerge through the zygomatico-facial foramen. So this foramen is the zygomatico-facial foramen. Okay. This zygomatico-temporal branch also communicates with that of the lacrimal nerve, which is actually a branch coming from the ophthalmic division of the trigeminal nerve. Okay, zygomatico-temporal also has a communicating branch to that of the lacrimal nerve. Okay, considers lacrimal nerve, which is coming from ophthalmic division. It has a communicating branch. So these are the branches of zygomatic branch. These are the branches of zygomatic. Next important branch in the fossa is posterior superior alveolar nerve. This is the posterior superior alveolar nerve. It will come down, it will pierce the anterior wall to enter in close relation with that of the maxillary sinus. The maxillary sinus will be located here, and it will supply the maxillary sinus. It will supply the mucosa of the maxillary sinus. Then it will enter down, and it will form plexus. To supply the molar tooth. Okay, that is about posterior superior alveolar nerve. So posterior superior alveolar nerve. So this posterior superior alveolar nerve is supplying the molar tooth. You can draw the tooth. These are the incisors, the two incisors. Then we have the canine followed by premolars, then by the molar. These are the roots of the tooth. These are the branches which are supplying the molar tooth. Okay. And these branches are supplying the maxillary sinus. maxillary sinus, branch to maxillary sinus. Okay. Next, there are two more branches here after it crosses the inferior orbital fissure. After it crosses the inferior orbital fissure, one nerve is coming down from the groove and other one is coming from the canal. Okay, one nerve is coming from the groove and other one is coming from the canal, and these two are called anterior, and this is called middle superior alveolar nerves. So this is the middle superior alveolar nerve, is the anterior superior alveolar nerve. Okay, so middle superior alveolar nerve, this is the anterior superior alveolar nerve. So the anterior superior alveolar nerve supplies the incisors, it will form plexus and supply the incisors and canine. Okay, the middle will supply the premolars, it will form plexus and supply the premolars. Okay, so these are the branches which are supplying the upper jaw, upper tooth, all those things. Okay. So this is about the course and branches of the maxillary nerve. Okay.